I hope everyone that watches this video gives the grace to watch it to the end to understand what I'm trying to say. So let's watch this and I'll comment.
If you are obese, please don't ever let a doctor or a healthcare provider tell you that you need to lose weight before they investigate further a symptom that you're having. If they want to delay getting a lab or getting imaging or having you see a specialist, they want to delay that because they say you need to lose weight first. You need to push back on that person, or you need to find someone else, because your health problems are not just blamed on your obesity or the amount of fat tissue that you have. You are allowed to have other health problems as well, and you deserve the respect and dignity of investigating those other symptoms as well.
Absolutely true. And you should get all the respect, all the everything you deserve. You should get checked on and all that, and all that. One thing I want to say is this. Most common thing in my as a registered nurse that I've seen patient coming in is chest pain. It's very common, chest pain. However, if you are obese, there is a test that you may not be able to do compared to the skinny counterpart. Not that you would not be able to do it, it's just going to be split in two parts. So if you come in with chest pain, we'll have to investigate to know what's going on. We drop lab, which is troponin, to see if there is any issue going in your cardiac enzyme in your system. And as we go further, we want to do echo, which is echogram, and we also want to do nuclear stress test. So stress test normally takes between 2 to 4 hours. Post preparations, where I'm working right now, they normally do it. It normally take at least maybe 5 hours because you wait in the middle, we prep you, we watch you. It's because we're injecting you with some radioactive stuff just to make sure we're able to see the structure of your heart, to track everything. As it says right here. So the issue is the machine itself have a weight cutoff mark right here. The machine can have a weight limit of 400 pounds. And if you are above that, I know in my hospital, they normally try to do it in 1 day test. 1 day test, if you weight limit for, I think for male is 250, for female is 200 pounds. Yes. If you are above that, they will have to split it to two parts, like one today, the other one tomorrow. Then we'll go from there. We know what is going on. So your weight do have an impact on your health, but that does not mean they should delay and telling you to wait until you wait till you lose weight and all that stuff. I'm sorry for whoever goes through that, and it's not like find someone else. They should at least start the process to help get you what you need to address the issue that bring you in. Weight issue, on the other hand, is a different ballgame. I just want everybody to be on the same page, to know that there are some tests that need to be split apart and all that stuff. There are some procedures and all that stuff. I hope we all love each other enough to help each other get assistance that we need. And another one that I see here that is very fascinating to me is this one.
As a chubby teen, I remember a visceral unease before each appointment at the pediatrician's office. I remember the doctor who chided my mom for buying 2% milk and not skim. Then, when I lost weight in my 20s, appointments with the doctor were transformed. I could focus on the issues I wanted to discuss rather than visits being dominated by talk of cutting calories.
This story here, written by a primary care physician, probably resonates with so many people. Fat people and thin people receive different care from medical professionals. That is just a fact. And while a lot of this mistreatment may be subconscious, in some cases, the fat phobia is plain as day. One study surveyed 400 Canadian physicians and found that almost 20% agreed with the statement, "I am disgusted treating patients with obesity." Imagine, disgusted. That's the word they used. And just imagine how many more are not admitting this to researchers. Research suggests that a combination of implicit and explicit negative obesity attitudes are associated with patient non-adherence, mistrust, poor recovery, and mental health outcomes. It also doesn't actually increase weight loss. In fact, 79 to 90% of respondents in one study reported using food to cope with weight stigma. So if you've experienced weight stigma from healthcare providers in your life, I am so truly sorry. There are weight neutral healthcare providers who who can help address the issues that you actually come into office with and not just your weight. In fact, there's a really great master list that I found at fatfriendlyhealthcareproviders.com that you can go through and explore. Or if you really like your doctor, be frank with them that unless you ask, that you don't want to talk about your weight. But to everyone else, this is just another friendly reminder that shaming others about their body or weight almost always does more harm than good. And we need to all do better.
At the end, we all should do better because shaming doesn't do anything. But I want to add that there are a lot of times when emergency happens, and even when you put the cardiac monitor on the chest, because of the fat tissues and all that stuff, the stuff is not picking up what is happening in your cardiac system. So your weight do have impact, and everybody can feel the way they want to feel, but that does not justify you treat anybody negatively. It's as simple as that. Another part I want to add to it is hope we love ourselves enough to do an action that will benefit our life. Because if you watch a show, I think 600 life pounds, 1,000 life pounds, and all that stuff, it's so horrible. I have a patient not long ago that is like close to 600 pounds. And when a guy is not on the floor, it takes 7 females just to turn to change the patient because the patient cannot change himself. And as a guy, it takes at least 4 of us because 2 people have to turn, have to pull, and 2 people have to push. Then the 5th person do the cleaning. So this is some other stuff that may create negative feelings from people that work in the hospital system. But that's not saying like they should treat people anyhow. No, justifying anybody's action. I'm just telling like let's help each other to get better. And I'm going to read 1 Timothy chapter 4, verse 8. It said physical training is good, but training for godliness is much better, promising benefit in this life and in the life to come. Are you in shape both physically and spiritually? In our society, much emphasis is placed on physical training. As you can see, everybody wants to go to gym, everybody wants to be hourglass. Not everybody is going to be that perfect 6-pack, 8-pack, 10-pack, or skinny body and all that stuff. No. Be healthy, be within your age, like weight age range, so that your body, your knee, because you can develop arthritis and all that stuff. Your knee does not get broken, your hip, all that stuff, and do as much cardio. Yeah, do as much cardio so that your heart is in good structure. So, and your back as well, mostly your back, because once your back is gone, it's difficult to come back. But spiritual health is even much more important. Our physical health is sustainable to disease and injury, but faith can sustain us through thriving. That's what I'm trying to say. So my back is nearly messed up because some like doing so many different stuff, assistant patient and all that stuff, bed down, you have to run into a coach, jumping stuff, you don't have time to so many different stuff happening. And a lot of people get born out of empathy, born out of compassion, work overload, stress, so many different stuff is going on. Not to justify treating people bad, no. I just want both the patient, both the physicians, both everybody around us, please let's work on both our physical health and our emotional and spiritual life as well, so that we can help each other get to the next stage in our life. And it said, lastly, here, to train ourselves to be godly, we must develop our faith by using our God given ability in the service of the church. Are you developing your spiritual muscle? So, are you developing your spiritual muscle? Are you working to be a positive impact to help people